the shoulder, not on your neck. I'm also going to palpate on your cervical spine. Do you feel any tenderness in this area?
No, I am not. If you feel any tenderness, I'm tapping on the cervical spine or lumbar spine, what would you think of? Fracture,
Abscess,
metastasis,
infection,
infection, tumors, right? You said frame it, right? If you have, you're tapping on the spinous processes of the neck, of the back, the patient. Ouch, ouch, ouch. It's something local. Frame it. We discussed that. Frame it. FR, fracture, right? ME, metastasis. T, tumor. I, infection, right? If there is any area that you can frame it and say the problem is here, I tap, ouch. I tap, ouch. Because canal stenosis will not give you this much local tenderness. The radiculopathy doesn't give you this much local tenderness. I am tapping on the bones and ouch, ouch. It's something local. Fracture, metastasis, tumor, infection, something like that. Thank you. I did not have any, there wasn't any local tenderness on tapping on my spine.
I would also like to check the movement of the neck from left to right and up and down. Up and down. So normal range of motion of the cervical spine.
3 more tests. How would you shake my infraspinatus?
Hands up.
External rotation.
Imagine that you're closing a book, right? It seems that the book is closed in front of you, right? I will actually put pressure on your hand to try to separate them from each other. You try to separate them from each other. So if she's good, press them against each other. I'm trying to open it up. I'm trying to open it up. And I'm trying to open that up. I am putting pressure on the infraspinatus. On the infraspinatus. As you said, external rotation. You're saying external rotation, right? My shoulder is externally rotating. The external rotation of the shoulder depends on my infraspinatus, right? How will you check my subscapularis?
You can have
lift off test.
Lift off test. I am so yeah, this is lift off. So you put your hand like me on your back. I am pressing it. You try to lift my hand. You try to lift my hand. So if I'm able to do that, lift up test for subscapularis. I cannot show subscapularis because it's the inner surface, right? And if you want to check impingement, you can do near test. Near up to the ear, right? I'm bringing my hand all the way up to my ears, and I'm putting it back. If there is any impingement, when those soft tissue parts are getting impinged, are getting pinched by the bony structures, right? So when I do that, ouch, it feels painful, right? You might even feel it when you do that, but the patient is not able to complete the movement. These are the major specific tests of the shoulder, right? So the empty can test for supraspinatus, external rotation for infraspinatus, right? The lift up test for subscapularis, and this near for the impingement. So these are specific tests of the shoulder. It was good, just don't forget the special test of that. And good that